So good morning to all of you. I'm Dr. Pradeep Pawar, Professor of Anatomy. I've got a vast experience of teaching anatomy for the undergraduates and the postgraduate entrances all over the country. Okay, we'll start with the MCQs. Fine. So students are joining. We'll start. Answer this first MCQ. Students, whatever you know, you answer. Now, even if it is wrong, that's fine. Don't retract your messages. You can answer this. A newborn is delivered at term to a 19-year-old primary gravida woman with spontaneous vaginal delivery. The mother had no prenatal care. On examination, the child has a small retracted jaw and hypoplasia of the zygomatic arch. The patient's condition is most likely caused by an abnormal development of structure that also gives rise to the following. Yes, what do you say? So you know, students, the maxilla and the mandible, these two bones are derived from which pharyngeal arch? Come on, answer this. The maxilla and the mandible, these are derived from the first pharyngeal arch. First pharyngeal arch. So what else is derived from the first pharyngeal arch? In the options that we have, what else is derived from the first pharyngeal arch? Incus. The answer for this would be incus. Clear to all of you? Incus. So students, if you can tell me what are the derivatives of the first pharyngeal arch? We'll start with the nerve. Start with the nerve of the first pharyngeal arch. Which is the nerve of the arch? First arch? Mandibular nerve. Mandibular nerve. And which are the muscles in the first pharyngeal arch? The muscles of mastication. The four muscles of mastication. Which are those? Temporalis, masseter, the medial and the lateral pterygoids. The medial and the lateral pterygoids, the temporalis, the masseter, yes. What else? The mylohyoid, the anterior belly of digastric. Two more muscles, one in the ear and one in the palate. The tensor palatii and tensor tympani. Tensor palatii and tensor tympani. So these are the muscles which are derived from the first pharyngeal arch. The nerve supply of this muscles is therefore mandibular nerve. Mandibular nerve. Which are the ligaments derived from the first arch? Anyone? The ligaments derived from the first pharyngeal arch would be, one is the anterior ligament of malleus, and the spinomandibular ligament. Anterior ligament of malleus and the spinomandibular ligament. The bones which are developed in this arch would be, one, the malleus, the incus, the maxilla, the mandible. These are the bones which are derived from the first pharyngeal arch. Fine, students. The second pharyngeal arch, which is the nerve of the second arch? The nerve of the second arch is going to be the facial nerve. And which are the muscles derived from the second arch? The muscles of facial expressions. All the muscles of facial expressions are derived from the second arch. One muscle in the ear, that's the stapedius. What else? The stylohyoid and the posterior belly of digastric. The stylohyoid and the posterior belly of digastric. So these are the derivatives of the second pharyngeal arch, right? Muscles of facial expression, the one muscle in the ear, that's stapedius, the stylohyoid and the posterior belly of digastric. So this would be derived from the second pharyngeal arch. Very good, Adi. Right. Which are the bones derived from the second arch, students? The bones derived from the second arch. One, anyone? The bones derived from the second pharyngeal arch. One is the styloid process. Yes, the stapes in the ear. The bone of the ear, the stapes. The lesser cornu and the upper part of the body of the hyoid bone. The lesser cornu of the hyoid and the upper part of the body of the hyoid bone. So this is all derived from the second pharyngeal arch. Clear? Nerve of the third arch. Nerve of the third arch is glossopharyngeal nerve, and the muscle of the third arch is stylopharyngeus muscle. Muscle of the third arch is the stylopharyngeus muscle. Clear? And the bone, the greater corner of the hyoid bone and the lower part of the body of the hyoid bone. is derived from the third arch. Lesser cornu and the lower part of the body of the hyoid bone is derived from the third pharyngeal arch. Which is the nerve of the fourth arch? But fourth arch, that's the superior laryngeal nerve, and the nerve of the sixth arch is a recurrent laryngeal nerve. And what is derived here are the muscles of the larynx and the pharynx. The muscles of larynx and pharynx. Okay, fine. So facial nerve is the nerve of the second arch. Cricothyroid would be derived in which arch? Yes, anyone? Answer this. Cricothyroid muscle is a muscle of which pharyngeal arch? Answer, I'm waiting for you. Cricothyroid muscle is a muscle of fourth pharyngeal arch. Fourth. Why? Which is the nerve of the fourth arch? Superior laryngeal nerve. Very good. And the superior laryngeal nerve divides into an external laryngeal nerve and an internal laryngeal nerve. The external laryngeal nerve is going to supply the cricothyroid. Cricothyroid, right? So the answer is fourth. External laryngeal nerve supplies the cricothyroid. So cricothyroid would be derived from fourth pharyngeal arch. Greater cornu of the hyoid bone would be derived from the third pharyngeal arch. The greater cornu and the lower part of the body of the hyoid is derived from the fourth pharyngeal arch. I hope this is clear to all of you. Okay. Going to the next MCQ, bachcho. Identify this structure, students. Identify this structure. Identify this structure. Good morning, good morning. Yes, come on, I'm waiting for you. Answer this. What is this structure that I've pointed? Bolo. This is the, what is this? This is the part of the midbrain, है ना? ये midbrain है. This is the midbrain, बच्चों. This is the pons and this is the medulla. Correct. So this is the midbrain. What is this part of the midbrain known as? Look, I'll just outline this for you. This part of the midbrain. What is this part of the midbrain known as? The crus cerebri. Crus cerebri नहीं बच्चे. This is not thalamus. ये thalamus नहीं है. This is the inferior view of the brain. This is the brainstem, बच्चा. This is the brainstem. Okay. So that's the crus cerebri or the cerebral peduncles. We call this as cerebral peduncles. What is this? If you can answer this, I'll put number 1. This is the optic nerve. Colliculus nahi hai ye. This is not colliculus also. This is not colliculus also. Don't get confused. ये जो देख रहे हो ना, this are the mammillary bodies. These are the mammillary bodies. This is the ventral aspect. Dorsal aspect नहीं है. On the dorsal aspect, you get a colliculus, the superior and inferior colliculus. Okay. So these are the mammillary bodies. What is this? This is the crus cerebri. Crus cerebri. This is the optic nerve. That's the optic chiasma, and this is the optic tract. Optic tract. So optic nerve, optic chiasma, optic tract. There's something very important which is lying here. What is this area known as? Can anyone answer this? A very important MCQ. What is this rhomboid shaped structure? What is this diamond shaped structure here? No, it's not the fourth ventricle. No, it's not the fourth ventricle. What is this diamond shaped structure? I'll draw this for you. बोल सकते हो? हाँ. Yes, you're somewhere close. Yes, Adi. Yes, what is that? See, I'll draw this for you. That's the optic nerve here. Optic nerve. This is the optic chiasma here. And that's the optic tract. Okay, optic nerve, optic chiasma, and that's the optic tract here. Clear? And what is this going to be now? This is going to be the crus cerebri or the cerebral peduncles here. That's the crus cerebri. This is the midbrain. That's the pons here, and this is going to be the medulla. That's the pyramids here. That's the olives here, and that's the inferior cerebellar peduncle. Inferior cerebellar peduncle. So what I am focusing on, बच्चों, what is this area? This is what I want you to understand. ये जो आप area देख रहे हो, this diamond shaped structure, and this is what we call as the interpeduncular fossa. Interpeduncular fossa. Now what lies in this interpeduncular fossa? What are the boundaries of this interpeduncular fossa? Anterolaterally is the optic tract. Posterolaterally is the crus cerebri. ठीक है? Optic tract anterolaterally, posterolaterally is the crus cerebri. And what is the floor of the interpedunclar fossa formed by? Who's going to form the floor? So, the floor is formed by the pituitary stalk, yoga pituitary stalk. These are the two mammillary bodies. The two mammillary bodies, mammillary bodies. And there's something perforated here. Yes, anyone can answer this. What is this known as? The posterior perforated substance. The posterior perforated substance. So this is the pituitary stalk or the infundibular stalk. These are the two mammillary bodies, and that's the posterior perforated substance. This is going to form the floor of the interpeduncular fossa. And why is this fossa so important? Why are we discussing this so much? Because, oh sorry, oh my god, this is gone, this is gone. Wait a minute, I'm so sorry for you. I'll draw this once again. So that's the optic nerve, optic chiasma, optic tract. No problem, I'll draw this once again. And what is this now? That's the crus cerebri. This is the cerebral peduncles, the crus cerebri, the pons, the medulla. Once again, a quick revision. That's the pyramids, that's the olives, that's the inferior cerebellar peduncle. So this area is the interpeduncular fossa. The floor of the interpeduncular fossa is formed by, one is the pituitary stalk, second are the mammillary bodies, and the third one is the posterior perforated substance. Posterior perforated substance. And why is this so important? Because there's a nerve which comes to lie in the interpeduncular fossa. What is this? Anyone, can you answer this? There's a nerve which lies on the ventral aspect of the midbrain. Come on students, what is this nerve? There's a nerve which arises from the midbrain on the ventral aspect. Yes, interpeduncular fossa, barabar hai, Adi. So there's a nerve which lies here, and this is the oculomotor nerve. Oculomotor nerve lies in the interpeduncular fossa, and there is a circle of Willis which lies here. Circle of Willis lies in the interpeduncular fossa. Interpeduncular fossa. Clear to all of you? So that is a very important MCQ. Now look, if I have to draw the brain, no, complete brain agar draw karna, dekho, if you are still not oriented with this. Ab dekho, ab clear hai? What is this view? बोल सकते हैं, what is this view of the brain? Now it should be clear. Huh? That's the inferior surface of the brain. Inferior surface. And what is this part of the temporal lobe known as? This is what we call as the uncus. Uncus. This part of the temporal lobe is known as the uncus. And deep to the uncus, hidden inside the uncus, iske andar, there's a part of the temporal lobe which is hidden, named the insula. Insula. So deep to the uncus is the insula. Is this clear to all of you? That's about the interpeduncular fossa. Okay, I'll clear this. Something else I'll tell you students, see if you can understand this. The entire neural tube is derived from what? Anyone, can you answer this? The entire neural tube is derived from ectoderm. Ectoderm say the ectoderm invaginates like this. Look, this is the ectoderm. The ectoderm folds like this. This fold becomes deep like this, and ab ye fold separate ho jata. What is this here? That's the neural tube. Neural tube. That means the entire neural tube is what in origin? It's ectodermal in origin. Remember, the entire neural tube is ectodermal in origin, and jab ye neural tube separate ho jata hai, when this neural tube is getting separated, it is not closed on the dorsal aspect. Look, I have not drawn it closed. It is open from the head to the tail. It's an open neural tube from the head to the tail. Now, where does the closure begin? Where does the closure begin? The closure begins in the neck, in the cervical region. Gradually, the neural tube closes in front. Gradually, the neural tube closes behind. The anterior end is still open. What is this known as? Anyone? The anterior open end of the neural tube is known as the anterior neuropore, and the posterior open end is known as the caudal neuropore. Caudal neuropore. Students, when does the anterior neuropore close? That's a very, very important MCQ for you. When does the anterior neuropore close? It closes by 25th day of intrauterine life. 25th day of intrauterine life. If this does not close, this part is open. What do you call this as? Anencephaly. The posterior neuropore closes by 28th 28th day, it's not 27th, now recent update, 28th day of intrauterine life. If it does not close, it results in spina bifida, right? So anterior is 25th, posterior is 28th. बस ऐसे याद रखना. And when this neural tube is being formed, a small group of cells get separated from the neural tube, from the ectoderm, and they lie on either sides of the neural tube. What do you call this as? This is what we call as the neural crest cells. Okay, so just understand this and remember this, neural crest cells. Now, that means the entire neural tube is derived from what? Ectoderm. And this neural tube is going to form the brain and the spinal cord. Now, I'll tell you something very interesting, students. Just be there. Just be there. Ek minute, I'll have to come out of this and again go to the screen. Okay, now have a look. Understand this. Something very interesting. So the neural tube shows 3 vesicles like this. 3 vesicles. बोल सकते हो? And then it continues down as the spinal cord. So what is this known as? Prosencephalon, mesencephalon, rhombencephalon. So prosencephalon, mesencephalon, rhombencephalon. Prosencephalon divides into telencephalon and diencephalon. Rhombencephalon divides into metencephalon, myelencephalon. Metencephalon and myelencephalon. Just understand this. Something very important I'm going to tell you, but I'm just clearing the basics. Now tell me, telencephalon से क्या बनता है? Cerebral hemispheres. Telencephalon से cerebral hemispheres बनता है. Diencephalon forms 5 things. Diencephalon forms thalamus, hypothalamus, epithalamus, metathalamus, subthalamus. These are the 5 things of the diencephalon. Okay, the thalamus, the hypothalamus, the epithalamus, the metathalamus, and the subthalamus. We'll come to this. What is the metencephalon form? The metencephalon forms the midbrain. The myelencephalon forms the pons and the cerebellum. And the myelencephalon forms the medulla. Metencephalon forms the pons and the cerebellum, and the myelencephalon forms the medulla. Dear students, so understand it like this. The prosencephalon divides into a telencephalon and diencephalon. Telencephalon forms the cerebral hemispheres. Tell me, what is the cavity of telencephalon known as? Come on, students. What is the cavity of telencephalon known as? The lateral ventricle. Cavity of telencephalon is known as lateral ventricle. The diencephalon divides into 5 things: a thalamus, a hypothalamus, epithalamus. Can anyone tell me what is this epithalamus made up of? Epithalamus is made up of 3 things: the pineal gland, the posterior commissure, and the habenular commissure. Okay, the pineal gland, the posterior commissure, and the habenular commissure. This is derived from epithalamus. Epithalamus के parts क्या होता है? Pineal gland, उसके ऊपर is the habenular commissure, and उसके नीचे is the posterior commissure. Together they form the epithalamus. Metathalamus is made up of what? Can anyone answer this? Metathalamus is made up of what? Metathalamus is made up of the medial and the lateral geniculate bodies. The medial and the lateral geniculate bodies, they form the metathalamus. And the last part of the diencephalon is the subthalamus. Subthalamus is the last part of the diencephalon. What is the cavity of the diencephalon known as? Anyone? What is the cavity of the diencephalon known as? The third ventricle. Okay. Mesencephalon forms the midbrain. What is the cavity of midbrain known as? Aqueduct of Sylvius. And what is the cavity of rhombencephalon? The fourth ventricle. Now, what I want you to understand is this. Understand this or no? That's a neural tube. That's a neural tube. It is divided into, this is something known as alar lamina, and this is the basal lamina. Alar and basal lamina. Basal lamina is motor and alar lamina is sensory. Alar lamina is sensory and basal lamina is motor. This is throughout this neural tube. Throughout the neural tube, you've got the alar lamina, which is on the dorsal aspect, and basal lamina, which is on the ventral aspect. So remember, students, all the sensory part is derived from alar lamina, and all the motor part is derived from basal lamina. Okay. So now, if I ask you, the nucleus of third nerve is derived from what? The nucleus of third nerve is derived from. For that, you have to know where is the nucleus of third nerve located. Bol sakte ho? Anyone? Where is the nucleus of the oculomotor nerve located? Yes. Where is the nucleus of the oculomotor nerve located? It is located in the midbrain. Midbrain is derived from what? Midbrain is derived from mesencephalon. Dekho, midbrain is derived from mesencephalon. Oculomotor nucleus is a motor nucleus. Yes, it's a motor nucleus. So oculomotor nucleus would be derived from the basal lamina of mesencephalon. This is something very important. Okay, oculomotor nucleus would be derived from the basal lamina of mesencephalon. Just tell me, second, motor nucleus of facial nerve. Where is the motor nucleus of facial nerve located? Anyone? Where is the motor nucleus of facial nerve located? The motor nucleus of facial nerve is located in the pons, and the motor nucleus of facial nerve is motor. It will be formed from basal lamina, right? It is motor, so it will be derived from basal lamina, and basal lamina of what? Pons and a pons. So pons is derived from what? Metencephalon. It is derived from metencephalon. Yes, so the motor nucleus of trigeminal nerve will be, the motor nucleus of facial nerve would be derived from the basal lamina of metencephalon. समझ में आ रहा है बच्चों? Are you following this? So that's how you have to understand this. एक याद रखना, alar lamina, basal lamina. Alar lamina forms the sensory part, basal lamina forms the motor part. तो जो भी sensory neurons होंगे, sensory input होगा, that will be derived from alar lamina, and all the motor part would be derived from basal lamina. For example, cerebellum. Cerebellum is mainly sensory, right? It is mainly sensory. So it would be derived from what? Alar lamina. It would be derived from alar lamina, and cerebellum as such is derived from what? It is derived from metencephalon. So cerebellum would be derived from the alar lamina of metencephalon. Alar lamina of metencephalon. Perfect. That's very important. So I've told you the concept, how to remember this. Very good, very good. Chalo. We'll go back to our slide here. So this was our slide. Correct. Come on, students, identify what is this structure. What is this structure? What is this structure? Come on, students, come on. Whatever you can answer, you answer. Come on, be fast. What is this structure? This is a nerve, and that's the third cranial nerve. That's the third cranial nerve, right? What is this structure that I'm pointing now? यही है मैं जो बोल रहा था. What is this structure that I'm pointing now? That's the mammillary body. Mammillary body. That's the mammillary body. And what is this here? ये perforations देख रहे हो? You can see this perforations here, है ना? You can see the perforations here. What is that? The posterior perforated substance. Posterior perforated substance. What is this groove for in the pons? What is this sulcus for? Anyone? What is this groove in the pons for? This one. This groove in the pons is for what? Come on. Answer, students. The groove in the pons is for the basilar artery. Basilar artery. This is the median sulcus or the basilar sulcus, and that's for the basilar artery. Fine. What is this junction known as? This is the pontomedullary junction. Pontomedullary junction, and there will be 3 nerves attached to this pontomedullary junction. Can anyone tell me which are these 3 nerves attached to the pontomedullary junction? I'll just draw this for you. Essay. Bolo. What are these 3 nerves attached to the pontomedullary junction? The 6th. This is the 6th, that's the 7th, and that's the 8th nerve. 6th, 7th, 8th nerve. What is this structure? I've marked with a star. What is this structure which is going towards the cerebellum? From the pons, this structure is going towards the cerebellum. Can anyone tell me what is this structure from the pons towards the cerebellum? A structure going from the pons towards the cerebellum. This one. That's the middle cerebellar peduncle. ये है middle cerebellar peduncle. Correct? This is the middle cerebellar peduncle. Okay. Now tell me, what is this structure? What is this structure? This is the pyramids. What is this? The next one. That's the olives. And for the next one is the inferior cerebellar peduncle. So that's the pyramids, that's the olives, and that's the inferior cerebellar peduncle. So pyramids are derived from crossing of corticospinal tracts. The pyramids are formed by crossing of corticospinal tracts. The olives are formed by the inferior olivary nucleus, which lies deep to it. The inferior olivary nucleus, and the last one is the inferior cerebellar peduncle. Inferior cerebellar peduncle. Okay, I hope this slide is clear to you. Answer this. Yes, a 38-year-old woman, gravida 2, para 1, and 24 weeks of gestation comes to the physician for a routine prenatal evaluation. She has no history of major medical illness and takes no medications. Fetal USG shows a cardiac defect resulting from abnormal development of endocardial cushions. This defect is most likely resulting in which of the following? Yes, students. This is atrioventricular septal defects. The answer is AV septal defects. Atrioventricular septal defects. Now understand this MCQ. This is another very important MCQ. Students, understand this. Now that's the atrium. That's the atrium. And that's the ventricle. That's the atrium and that's the ventricle. What is this which is formed here? The first thing which is formed before the formation of the interatrial and the interventricular septum. The first thing which is formed here is the AV cushion. That's the AV cushion. Okay, so before the formation of interatrial and interventricular septum, that's the AV cushion. AV cushion. And there's something here. That's the septum spurium. Iska naam hai septum spurium. Now what is that? I'll tell you later. Now, if this AV cushion is not formed, this AV cushion is very important. The moment this AV cushion is formed, अब interatrial septum बनेगा, interventricular septum बनेगा. If this AV cushion itself is not there, there's going to be a septal defect. Septal defect होंगे. How? Just understand this. Now tell me, students, what is this septum which begins to grow from the wall of the atrium? Answer whatever you know. आप answer करिए. What is this septum which begins to grow from the wall of the atrium? That's the septum primum. Students, ये है septum primum, and the septum primum is growing towards the AV cushion. Correct? It is going towards the AV cushion. Now, what is this opening known as? This opening is known as the ostium primum, or it is known as the foramen primum. Foramen primum or ostium primum. So, septum primum grows from the wall of the atria, grows towards the AV cushion. The opening between them is known as the ostium primum. अब septum primum comes and fuses with this AV cushion. ये fuse हो जाता है, and the moment it fuses, it breaks off. The moment it fuses, it breaks off in between. ये बीच में break हो जाता है. Sorry, it breaks off in between. The moment it fuses, it breaks off in between. I'll draw it like this. Now students, what is this opening known as? What is this opening known as? This is what we call as ostium secundum or foramen secundum. Foramen secundum. So septum primum comes and fuses with this AV cushion and breaks off in between. This opening is now known as foramen secundum. Foramen secundum. Now another septum starts to grow here. And what is this septum known as? That's the septum secundum. And this septum secundum comes and lies next to the septum primum. The septum secundum comes and lies next to the septum primum, and this opening is now known as the foramen ovale. Foramen ovale. So now you tell me, agar ye AV cushion nahi hoga, if the AV cushion itself is not there, the septum primum cannot come and fuse with anything. So there's going to be a septum primum defect. There's going to be a defect in the interatrial septum. You're understanding? Because the interatrial septum to septum primum hota hai, it comes and fuses with the AV cushion. And then it breaks off in between. Agar ye AV cushion nahi hoga, there's going to be a septum primum defect. That's a defect of the interatrial septum. Okay. Now, students, understand this. This is the truncus arteriosus. That's the ventricles. That's the ventricles here, and this is going to be the atria behind. This is the atria behind. So that's the truncus arteriosus. That's the ventricle. Ye hoga atria. What is this in between? That's the AV cushion. That's the AV cushion, and this was the formation of interatrial septum. This you've understood. Now, how is the interventricular septum formed? The interventricular septum is made up of two parts. एक होता है muscular part, एक होता है membranous part. Muscular part, membranous part. So the muscular part grows in. The muscular part starts to grow in the floor of the ventricular cavity. The muscular part grows in the floor of the ventricular cavity. तो ये होगा muscular part. There's another part which is formed in the truncus arteriosus. What is this septum which is formed in the truncus arteriosus known as? Anyone? This septum which is formed in the truncus arteriosus is known as bulbar septum. Bulbar septum. This is the muscular part of interventricular septum. Interventricular septum. So interventricular septum is contributed by the muscular part which grows in the floor of the ventricular cavity. A bulbar part which is formed in the conus. In the conus, this bulbar part is formed, and this part in between, ये जो part बीच में बचा हुआ है, this part will be formed by the proliferation of AV cushion. This part will be formed by the proliferation of AV cushion. Okay, this is proliferation of AV cushion, right? So this proliferation of AV cushion forms the membranous part of the interventricular septum. So students, if the AV cushion is not there, there's going to be a defective interventricular septum as well as a defective interatrial septum. Is this MCQ clear? So if there's an AV cushion defect, if the AV cushion is not formed, there will be defects in the atrioventricular septum. I hope this is clear to all of you. Kuch doubts hai to bolo. This is the membranous part. Of interventricular septum, and that's the muscular part. Okay, so this is very clear. I hope this is clear to all of you. Yes, bachcho, is this clear? So I'll just once again quickly repeat this for you. Interventricular septum is made up of two parts. One is the muscular part, second is the membranous part. The muscular part grows in the floor of the ventricular cavity. It grows in the floor of the ventricular cavity. The membranous part is derived from two sources. One is the bulbar septum, which is formed in the conus. Bulbar septum which is formed in the conus, and the second one is the proliferation of AV cushions. That's the MCQ. Have a look at this. This was MCQ. So fetal USG shows a cardiac defect resulting from abnormal development of endocardial cushions. Endocardial cushions is AV cushion. The defect is most likely to result in, answer is atrioventricular septal defects. Okay. So when do you get a patent foramen ovale? Patent foramen ovale is when you get this, when the septum primum and septum secundum does not fuse. The septum primum does not fuse with the septum secundum. You get a patent foramen ovale. Clear? Failure of fusion of septum primum with the septum secundum leads to a patent foramen ovale. And how do you get a TOF? How do you get a TOF, students? TOF, Tetralogy of Fallot. कैसे बनता है ये Tetralogy of Fallot? This is another very important thing that you should know. Now tell me, what is this first chamber of the heart? The first chamber of the heart is ये ventricles है, and this is the atrium. So the first chamber of the heart is the truncus arteriosus. Truncus arteriosus. And in this truncus arteriosus, एक septum बनता है ऐसे. What is this septum known as? This septum is known as the aorticopulmonary septum. Aorticopulmonary septum. This is also known as the bulbar septum, or this is also known as the spiral septum. Okay, so where is this septum formed? This septum is formed in the truncus arteriosus, students. And this septum which is formed in the truncus arteriosus is going to divide the truncus arteriosus. ये side view है. This is a side view. This is a view from front. आप सामने से देख रहे हो. So this septum which is formed here divides this truncus arteriosus into two big blood vessels. What are these two big blood vessels? One is the pulmonary trunk and the other one is the ascending aorta. Pulmonary trunk and ascending aorta. तो ये जो septum है, this septum is known as the bulbar septum, or this septum, this septum is known as the aorticopulmonary septum, or this septum is also known as the spiral septum. Sorry, not bulbar septum. This septum is also known as the aorticopulmonary septum or spiral septum. And this septum is going to divide this truncus arteriosus into two big blood vessels, the ascending aorta and the pulmonary trunk. Now this septum is going to spiral like this, spiral, 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 and this septum is also known as the spiral septum. It spirals in such a way that the aorta opens into left ventricle and the pulmonary trunk opens into the right ventricle, Now who's going to migrate into this septum? The neural crest cells. The neural crest cells migrate into the septum. Now students, normally this septum is formed right in the midline. ये जो septum है ना, it is formed right in the midline. So ascending aorta and pulmonary trunk are of the same size के बनते हैं. But if the neural crest cells do not migrate into the septum goes to one side. The septum is shifted to the right side. Sorry, the septum is shifted to the right side. एक मिनट. So I'll make this as the pulmonary trunk, I'll make this as the ascending aorta, just for our understanding. So the septum goes to the right side. The septum is shifted to the right side. So what happens is, the pulmonary trunk becomes very small in size. There's a pulmonary stenosis. When the septum shifts to the right side, there is going to be a pulmonary stenosis. Because of the pulmonary stenosis, what happens is, the right ventricle contracts, leading to a right ventricular hypertrophy. Because of the right ventricular hypertrophy and the pressure, there's a interventricular septal defect. And because of this interventricular septal defect, there's going to be an overriding of aorta, and this is what we call as the Fallot's tetralogy, right? So this is what we call as Fallot's tetralogy. So how is the Fallot's tetralogy formed? What is the main cause for Fallot of? Pulmonary stenosis. And how do we get pulmonary stenosis? Because the septum shifts to the right side. Because the septum shifts to the right side, pulmonary stenosis हो गया. Because of pulmonary stenosis, RVH. Because of RVH, a septal defect. And because of septal defect, the overriding of aorta. Is this clear to all of you? Okay, I hope this is all clear to you. So that's Tetralogy of Fallot. Now coming to the next MCQ, answer this. Yes, anyone? Anyone, answer this. During cystoscopy, the urologist notices a triangular shining area devoid of mucosal folds. Yes, opposite to the apex of the bladder. So ये होगा base of the bladder. He identifies it as the tricone. Yes. All the following statements about the tricone are true except. It is derived from the urogenital sinus. Very good. Derived from urogenital sinus. Have a look at this slide. Look at this. This is the tricone of the bladder. And rest of the bladder, the mucosa is folded. And the entire bladder mein mucosa is folded like this, folded. Except at the tricone, the mucosa is very firmly attached. The mucosa is very firmly attached at the tricone of the bladder. It is fixed to the tricone of the bladder. So it shines. It is shiny. It is shining. The mucosa is very firmly attached. I'll make this slide for you. Understand this. Tell me, students, what is the last part of the hindgut? This is the hindgut. And what is this comma-shaped structure in the hindgut? Anyone, can you answer this? That's the hindgut. That's the last part of the gut. And what is this comma-shaped structure? Anyone? This is the allantois or the urachus. So this comma-shaped structure is known as the allantois or the urachus. The part of the hindgut below the attachment of the allantois, this part is known as the cloaca. So appendix nahi hai bachcha, ye appendix nahi hai. This is known as allantois, or this is known as the urachus. So this is the last part of the gut, and you get a comma-shaped structure which is known as the allantois, or it is known as the urachus. The part of the hindgut below the attachment of the allantois is known as the cloaca. Just understand this. The part of the hindgut below the attachment of allantois is known as cloaca. Now a septum is formed here. And the septum is going to divide the cloaca. What is the name of the septum? The name of the septum is urorectal septum. And this urorectal septum is going to divide the cloaca into two parts. It divides the cloaca into two parts. This is known as the I'll write it here, urogenital sinus, and this is going to form, the posterior part is going to form the rectum and anal canal. Okay? So students, this is the cloaca, and cloaca makes septum banta. What is the septum which is formed in the cloaca? Known as the urorectal septum. And this urorectal septum is going to divide the cloaca into two parts. The part in front is known as the urogenital sinus, and the part behind is known as what? The part behind is going to form the rectum and the anal canal. What is this urogenital sinus going to form? It forms the bladder, urinary bladder. So the entire bladder is derived from the cloaca, urogenital sinus. Urogenital sinus is a part of cloaca. Cloaca belongs to the hindgut. That means the bladder is derived from the GIT. The bladder is therefore what in origin? Endodermal in origin. The entire bladder is endodermal in origin. Wait, I have not completed my sentence. Wait. So now, if you see the bladder now, dekho, ye hai bladder. That's the bladder. So this bladder is derived from the urogenital sinus. ठीक है? Urogenital sinus is a part of cloaca, Cloaca is a part of the hindgut. That means the entire bladder is endodermal in origin. Now, in this bladder, there are two ducts which are opening here. Those ducts ऐसे open होते हैं. What are these two ducts opening inside the bladder? Can anyone tell me this? These two ducts, this is known as the mesonephric ducts. The two mesonephric ducts are going to open into the bladder, and this mesonephric duct is mesodermal in origin. The mesonephric duct is mesodermal in origin. Now this two mesonephric ducts opens into the bladder, and this mesonephric duct gives a small bud here, and this bud is going to form the collecting part. This is known as the ureteric bud. Ureteric bud. ये ureter वगैरह बनाते हैं, हाँ? The minor calyx, the major calyx, the pelvis, ureter. So students, there are two ducts which opens into this urogenital sinus or into the bladder, and these two ducts are the mesonephric ducts. Mesonephric ducts gives two buds which are known as the ureteric bud. Okay, ureteric bud. At this point of time, if you see, how many openings in the bladder are seen? How many openings in the bladder will be there? There will be two openings in the bladder of this two mesonephric duct, है ना? दो openings होंगे of this two mesonephric duct. After some time क्या होता है? देखिए, after some time what happens? After some time, this much part of the mesonephric duct is absorbed into the bladder. Itna part of mesonephric duct. So this much part of mesonephric duct is absorbed into the bladder. अब कितने openings होंगे? How many openings do you have? You've got this four openings. Two of the mesonephric ducts and two of the ureteric bud. These are the two openings of the ureteric bud, and this will be the two openings of the mesonephric ducts. So now you've got four openings, and this part of the mesonephric duct which is absorbed into the bladder is known as trigone of the bladder. ठीक है? So trigone of the bladder is derived from the absorbed mesonephric ducts. It is derived from the absorbed mesonephric ducts. And mesonephric ducts are what in origin? These are mesodermal in origin, and that is how we say the entire bladder is endodermal in origin except the trigone, which is mesodermal in origin. Except trigone, which is derived from mesoderm. I hope this is clear to all of you. Except trigone, which is derived from mesoderm. Okay, clear to all of you. Now before we proceed, I'll just brief you about our platform, students. So we've got a plus subscription in which you've got access to both live and recorded classes, learning from the top educators. You've got live tests and quizzes, study on the device of your choice, and now you can access to this question bank which has 25,000 plus MCQs. An iconic subscription, students, in which you get the best of Unacademy and pre-planner. Some special class features for you in which there are interactive live classes, always a live interaction going on. There's poll for the learners. We put polls in which the students can answer the MCQs. Poll for the learners. Raise a hand technique in which if there's any doubt, the student can press the icon, can talk directly with the educator. Never miss a class with proper notifications being given to the students. Lecture notes, if a student misses a particular class, he can as well attend the recorded lectures, and all the lectures are in the form of PDF also. Anytime, anywhere, a student can access the class and get his doubts solved. Okay. Now, a highly updated and effective question bank has been prepared for you with the latest questions with a detailed explanatory answers to some 25,000 plus questions from the bank. Now, raise a hand technique, I just told you this. Now, these are our toppers who have got very good rank in the recent NEET PG exams. We congratulate all of them. And students, this is a schedule for you. So, 3rd is already over, 7th is already over, and 10th is already over. So, today is 12th. Right? So, every Friday, this is what we call as a ritual, students. Every Friday, at 9 p.m. Okay, there's a YouTube ritual test. So ritual is a regular test at a regular time on a regular day. So this is Fridays, time is 9 p.m. a YouTube ritual test. And students, on Saturday you've got a marathon test. Again, another ritual at 9 o'clock on Fridays. You've got a marathon test. Plus students, on Wednesdays 9 p.m. you've got a scholarship test. You've got a pathology scholarship test on 17th and PSM scholarship test on 24th at 9 p.m. These are free tests, students. Give this test, crack this exams. You are eligible for a scholarship. You can get a free subscription also for Unacademy. Okay, so give this test. On Saturday, there's a FMG grant test. Just pass this message to your friends. On 14th, 10 a.m. Sunday, you got a free grant test. And 20th Sunday, you got a combat test for the FMGE students. Okay, attempt this test. It's a free test. Now students, we are starting with 2 new courses from 17th of November. We are starting with this Focus FMG 2022 batch. Focus FMG 2022, it's a very comprehensive batch. And we having this free FMG test. This was 13th. Students, 13th of November, 9 p.m. You got this free FMG grant test. Just pass this message to your friends. Again, starting with 2 new batches for you. One is Target NEET 2022 batch and Target Next Integrated batch, subject wise 2023. From 23rd of November, download the Unacademy app and subscribe to it. Okay. Chalo students, if you can identify this structure. Identify the structure. Identify this pointed structure. A very important MCQ. Okay. What is this region? Get oriented to this pele. Where are we? Which region is this? This is the gluteal region. ये gluteal region है ना? ये gluteal region है. You can see this ligament here. ये क्या ligament है? Sacrotuberous ligament. देख रहे हो? That's a sacrotuberous ligament. What is this pointed structure? This is a muscle. Piriformis. Very good. This muscle is the piriformis. देखो. And this muscle is known as the key muscle of the gluteal region. The key muscle of the gluteal region. That's piriformis. What is this nerve? That's the sciatic nerve. What is this nerve? Can anyone identify this nerve for me? Students, what is that nerve? What is this nerve? That's a posterior femoral cutaneous nerve of thigh. Posterior femoral cutaneous nerve of thigh. Or you can write it as posterior cutaneous nerve of thigh. That's number 2. Number 1 is going to be what? Sacrotuberous ligament. Sacrotuberous ligament. Number 3 is piriformis. Piriformis, right? Yes. So can you identify this hamstring? ये क्या हो सकता है? What is this? These are the hamstring muscles. ये hamstring muscles है ना? And there will be a nerve above the piriformis. Can anyone guess this? It's not shown here. I have just drawn this for you. क्या हो सकता है ये nerve? What can be this nerve above the piriformis? The nerve above the piriformis is the superior gluteal nerve and vessels. Now this piriformis is known as the KEY, the key muscle of the gluteal region, because plenty of structures are surrounding the piriformis. At the superior border of piriformis, there's the superior gluteal nerve and vessels. At the inferior border of piriformis, that's the inferior gluteal nerve and vessels. Then you get the sciatic nerve, you get the posterior femoral cutaneous nerve thigh, you get three structures with the name of PIN, P-I-N, pudendal nerve, the internal pudendal vessels, and the nerve 2 obturator internus. Nerve 2 obturator internus. Fine. Okay. Answer this. What is this histological slide? What is this histological slide? Yes, students. Yes. What is this histological slide? That's the duodenum. Very good, duodenum. Duodenum. Very good. What is this? What are these finger-like processes, finger-like projections? This is known as the villus. So the moment you find villus, finger-like processes, it is a slide of small intestines. Perfect. Villus dekha, so it's a slide of small intestines. That means it would be either duodenum, jejunum, or ileum. It can be duodenum, jejunum, or ileum. So if it is duodenum, what else do we get here? Along with the villus, we get this glands here. These are the Brunner's glands. Brunner's glands. So Brunner's glands are found in duodenum. Agar ye ileum hota, ileum. So in the ileum, you will be getting such lymphoid follicles here. Lymphoid follicles in the ileum. What are those lymphoid follicles known as? This would be known as Peyer's patches. Peyer's patches. So Peyer's patches would be found in the ileum. So villus with Peyer's patches, that's ileum. Villus with Brunner's glands, that's duodenum. And villus with nothing specific, neither Brunner's glands nor Peyer's patches, that becomes what? Jejunum. Is this clear? Yes. So that's jejunum. So this is a slide of duodenum. You know the layers of GIT. I hope you must be knowing this. The layers of GIT, the mucosa, the submucosa, the muscularis externa, and the serosa. Mucosa, submucosa, muscularis externa, and serosa. The mucosa is made up of three parts. One, the epithelium, the lamina propria, and the muscularis mucosa. Epithelium, the lining epithelium, the lamina propria, and the muscularis mucosa. These are the parts of mucosa. Then you have got the submucosa. Then is the muscularis externa. Muscularis externa mein kya hota hai? Inner circular and outer longitudinal muscles. And the last one is serosa. Okay, last slide of the day. Can you identify this slide? What is this slide? Again, ये villus है. This is villus. This is not large intestine. Anyone? What is this slide? These are finger-like projections. These are villus. इसमें Brunner's glands नहीं दिखता, इसमें Peyer's patches नहीं दिखते. So this has to be jejunum. These are villus. And what are these empty cells here? What are these empty cells inside the villus? These are the goblet cells. Colon नहीं है ये, colon नहीं है. Colon में you'll be getting plenty of goblet cells, plenty. ऐसे finger-like projections नहीं दिखते. ये finger-like projections ही है. These are villus. ये villus ही है. These are finger-like projections. These are villus. Okay. So colon, I don't have the slide, but colon you'll be getting all empty cells. That would be colon. These are villus and these are goblet cells. देखो goblet cells बीच में आते हैं ना, बीच में, they are in between. Had this been large intestine, you will be getting all goblet cells. So this is a slide of jejunum. So Peyer's patches नहीं दिखते इसमें, Brunner's glands भी नहीं दिखते. So this is a slide of jejunum. I hope students, you've understood this lecture of today. and you've enjoyed the lecture. It was a good interactive session with you all, and thank you to all of you. Thank you to all of you. Thank you. I hope everything is clear. Any doubts you have, you can ask me. Thank you and bye bye. Thank you and bye bye.